Imagine this, the largest healthcare fraud crackdown in American history, codenamed Operation Gold Rush, was launched to expose massive Medicare and Medicaid scams worth a staggering $14.6 billion. Among hundreds of accused medical professionals, one name stood out: Michele Rene Luzzi Muzyka, a 60-year-old advanced practice registered nurse, APRN, from Cheshire, Connecticut. This woman was not only suspected of violating professional standards, but also accused of directly endangering patients' lives through illegal prescribing practices. According to the U.S. Department of Justice, Michele Muzyka abused her advanced nursing license to issue prescriptions for controlled substances, including Adderall and Xanax, to patients who had no legitimate medical need. In many cases, patients were prescribed these drugs after only a brief, superficial examination and were charged a flat fee of $200 in cash per visit, ignoring insurance rules or legal medical requirements. Even worse, at least 5 patients were confirmed dead within 30 days of taking the medications Muzyka prescribed. Local pharmacists had repeatedly raised red flags about the suspiciously high number of prescriptions coming out of Muzyka's clinic. Since 2022, pharmacies around Cheshire began to notice unusually high-dose prescriptions and an excessive frequency, mostly for Schedule II controlled substances. These reports triggered a federal investigation coordinated between the FBI and the Department of Health and Human Services, HHS. Investigators found that Muzyka not only carelessly prescribed these drugs, but also intentionally falsified medical records to cover her tracks. During undercover operations, federal agents posed as patients, describing vague symptoms, and with only a cash payment, they walked away with powerful prescriptions. This blatantly violated federal law and medical ethics, given that drugs like Adderall and Xanax have a very high potential for addiction and must be strictly monitored. Furthermore, Muzyka was accused of submitting false information to insurance providers, inflating medical fees to fraudulently profit from Medicare and Medicaid. At the same time, Operation Gold Rush uncovered a far bigger international criminal network centered in Russia and Eastern Europe. These groups had purchased U.S.-based durable medical equipment companies, then created fake patient records to bill Medicare billions of dollars for equipment that never existed or was never delivered. Among them, a company in Bethel, Connecticut named Medical Home Care was bought by a Czech national in March 2023 and quickly came under investigation for submitting $7 million in fraudulent claims, successfully pulling in $1.78 million in reimbursements before being caught. Altogether, 324 defendants were arrested in this operation, including 96 medical professionals spanning doctors, nurses, pharmacists, and DME executives. Federal authorities also seized about $245 million in cash, real estate, luxury vehicles, and cryptocurrency, and blocked an additional $4 billion in fraudulent claims before they could be paid out. As for Michele Muzyka, after her arrest on June 23, she was released on a $75,000 unsecured bond and placed under a strict ban from prescribing any controlled substances while awaiting trial. Her attorney has declared her innocence, but federal prosecutors continue to charge her with unlawful distribution of controlled substances, making false healthcare statements, and defrauding federal healthcare programs. Muzyka's case quickly rattled the local community in Connecticut. She had been known for many years as a caring nurse, trusted by her patients, but driven by greed, she transformed a small Cheshire clinic into an illegal prescription mill, fueling the opioid and benzodiazepine abuse crisis that is spreading throughout America. Some witnesses testified that Muzyka sometimes did not even check a patient's medical history or run basic tests, simply listening to their complaints for a moment before writing powerful prescriptions. That may explain why her patients had an abnormally high death rate, with at least 5 losing their lives within just a few weeks. With the scale of Operation Gold Rush, healthcare officials have pledged to expand investigations, tracing every link of these prescription fraud and insurance scams to protect people's lives and safety, especially those in vulnerable communities.
Continuing the shocking story of Michele Muzyka, residents across Connecticut have been left asking, how could a nurse with a long career and a reputation for caring so thoroughly fall so far as to face such serious criminal charges? Investigations show that after the COVID-19 pandemic, the demand for remote healthcare and medications for anxiety, insomnia, and ADHD surged dramatically. Vulnerable patients sought out Muzyka as what they saw as a convenient solution, thinking she was easygoing and would not require endless lab tests or red tape. Muzyka took advantage of precisely this trust to transform it into a profitable but illegal operation. According to federal investigators, Muzyka's pattern of abuse began around 2021. The Connecticut Prescription Drug Monitoring Program flagged a dramatic spike in the number of stimulant and sedative prescriptions coming from her practice compared to her peers. In just the last 6 months of 2022, she wrote more than 1,200 prescriptions for Adderall, Xanax, and Valium, all highly addictive, more than 3 times the amount a typical community practice of similar size would reasonably issue. Investigators found that Muzyka often ignored proper medical evaluations. Patients only had to mention insomnia or stress, and that was enough for her to write them prescriptions. This practice led many individuals to become addicted with no proper long-term treatment plan, resulting in severe complications affecting their cardiovascular and nervous systems, even death. Authorities confirmed at least 5 patients died within 30 days of receiving medications from Muzyka. During undercover operations, federal agents posed as patients and secretly recorded their visits. They documented a consistent pattern. A patient would pay $200 in cash, describe extremely vague symptoms, and within 5 minutes, Muzyka would hand them a prescription for very powerful drugs with no further instructions or warnings. Another worrying aspect was Muzyka's intentional falsification of medical records to commit insurance fraud. In numerous cases, she reported services she had never actually performed, inflated treatment hours, and added fake medical procedures to bill Medicare and Medicaid for higher amounts. These inflated claims amounted to tens of thousands of dollars over the past 2 years alone. Once Operation Gold Rush was launched nationwide, the FBI and federal health officials quickly classified Muzyka as a priority target. They also reviewed the broader medical network around Cheshire, and several local physicians and pharmacists stepped forward to assist the investigation, reporting that they had warned Muzyka for years about her dangerous prescribing patterns but were ignored. Muzyka's case was not alone. The investigation also exposed a much bigger picture. Many durable medical equipment (DME) companies actively cooperated with international criminals. Groups based in Russia and Eastern Europe systematically acquired legitimate U.S. companies, then used fake patient lists to submit false claims to Medicare for billions of dollars worth of equipment never delivered. One example was Medical Home Care in Bethel, Connecticut, which was bought by a Czech national and laundered more than $1.7 million in Medicare reimbursements through fake claims. The company has since been shut down, its owner arrested, and is now facing federal fraud charges. This enormous sweep revealed a truly global network involving doctors, nurses, DME company owners, patient recruiters, medical record forgers, money launderers, and transporters. Several suspects have already fled the country, but U.S. authorities are cooperating with Interpol to seek extradition for prosecution. As for Muzyka, after her initial hearing, she was released on a $75,000 bond, but under extremely strict conditions. She may not practice nursing, may not possess or prescribe any controlled substances, and must report regularly to federal court authorities. If she violates these conditions, she will be taken back into custody immediately. In the Cheshire community, this case has left many of Muzyka's former patients shocked. Some said they trusted her for years because of her gentle manner and her willingness to listen. But it was precisely that open-door attitude that made them vulnerable to falling into prescription drug dependency, requiring rehab or addiction therapy later. Healthcare experts across Connecticut have called this case a loud warning. Prescription drug monitoring systems must be strengthened, and small community clinics must be subject to random inspections more frequently to avoid a repeat of a single professional's abuse harming countless lives, as happened with Michele Muzyka.
Moving forward with the latest developments, Michele Muzyka's preliminary federal court hearing took place at the end of June in the District of Connecticut. Prosecutors presented substantial evidence, including undercover video recordings showing agents posing as patients, as well as copies of prescriptions bearing Muzyka's signature for people with no clear medical justification. These materials showed she had blatantly ignored the mandatory requirement for careful patient evaluation, especially when prescribing tightly controlled drugs. Muzyka's defense attorney continued to argue that she had been tricked by patients with addiction problems and that she was merely trying to help during a stressful post-pandemic period. However, prosecutors firmly countered, pointing out that Muzyka was the one actively collecting cash payments and handing out extremely powerful prescriptions with little to no oversight, describing this as a systematic pattern, not an accident. In Cheshire, Muzyka's case has sparked a heated discussion about professional ethics in healthcare. Many longtime patients expressed shock and disappointment because they had trusted her as a caring nurse with no ulterior motives. On the other hand, several local doctors had already warned for years about her reckless prescribing practices, and some argued that authorities should place stricter oversight on independently practicing nurses like Muzyka, who can become a weak link for exploitation or fall prey to greed. Meanwhile, the U.S. Department of Justice released expanded results from Operation Gold Rush, revealing enormous additional fraud schemes outside of Connecticut. Many durable medical equipment, or DME, firms in Florida, New York, and Texas had created fake patient lists and billed Medicare for millions of dollars in equipment that never existed and was never shipped. These groups coordinated their efforts between Russia, Eastern Europe, and American brokers, forming such a sophisticated network that without advanced forensic investigators, it would have been nearly impossible to uncover. Thanks to this nationwide operation, the federal government successfully seized $245 million in cash, assets, cryptocurrency, and property, and blocked more than $4 billion in fraudulent Medicare payments that were about to be issued. It was widely regarded as a major victory for American law enforcement, considering how sophisticated and cross-border these healthcare fraud schemes have become. Back to Michele Muzyka. If she is convicted on all counts, she could face up to 20 years in federal prison, hundreds of thousands of dollars in fines, and a permanent ban on practicing as a nurse. The court has scheduled her next hearing for September. Meanwhile, Muzyka's former patients are being urged to contact public health authorities to review their treatment histories in case they were given illegal prescriptions that might place their long-term health at risk. Perhaps the most sobering aspect of this case is its social consequences. Some families of patients who died after receiving Muzyka's prescriptions have already filed civil lawsuits for damages and are demanding answers from local healthcare regulators. They argue that if prescription monitoring systems had been enforced more rigorously, and if warnings from pharmacists and other doctors had been heard sooner, these deaths might have been prevented. Addiction control experts have also sounded the alarm, describing this scandal as a clear reminder of the commercialization of healthcare, where some medical professionals treat patients as revenue sources with no regard for outcomes. They're urging federal agencies to strengthen oversight of Schedule II drugs, those with high addiction risks, and give local health inspectors greater authority to perform surprise audits to catch abuses early. Financial crime analysts noted that weaknesses in Medicare and Medicaid auditing procedures had given international criminals an easy opening. A group simply had to buy a legitimate business license, maintain a plausible U.S. address, and then fabricate paperwork enough to slip past most online verification systems. These loopholes have existed for years and were never fully closed. Meanwhile, the Cheshire community remains stunned. Some of Muzyka's former patients described feelings of fear and betrayal, losing confidence in community healthcare. They worry there may be more cases like this waiting to be uncovered, and that if large-scale investigations like Operation Gold Rush had not happened, thousands more Americans could have fallen victim. In the end, the lesson from Michele Muzyka's prosecution and the entire Operation Gold Rush effort is this: greed can turn even once respected, trusted professionals into criminals if left unchecked. In a profession as vital as healthcare, a single weak link can lead to catastrophic consequences, costing society both lives and tremendous financial damage. Officials urge patients, especially using controlled medications, to be cautious whenever a medical professional offers easy access to strong drugs or asks for cash payments instead of going through insurance. They stress the importance of reporting suspicious patterns because speaking up in time might save many others from addiction, health collapse, or even death. Today, Michele Muzyka faces a long legal battle ahead. Though the law presumes she is innocent until proven guilty, the volume of medical records, undercover footage, and witness testimony has left the public with little doubt about her misconduct. This case is expected to set a precedent for tighter healthcare oversight, particularly as telemedicine expands in the post-pandemic world. In closing, Muzyka's story, combined with Operation Gold Rush, should serve as a wake-up call for the entire American healthcare system. Only through transparency, strict oversight, and a commitment to patient safety over profit can the system begin to restore public trust.
In the end, this case is a powerful reminder that even respected, trusted medical professionals can fall victim to greed and cross ethical lines, with devastating consequences. It shows that strict oversight, transparent medical practices, and a culture of accountability are critical to protect patients and rebuild public trust in healthcare. If you found this story important, please consider subscribing to our channel, giving this video a like, and sharing your thoughts in the comments below. Together, we can raise awareness about healthcare crimes and help prevent tragedies like this in the future.